members who have some contracts with the government. I think the problem, though, is a lot of those, I think, are older thinking around contingency funds, and there's not always the dollars that match up. Sometimes you don't know what the demand is until it's too late. And I think our ability to ramp up and then deliver what we're on the hook for is in reality not meshing very well, if that makes sense. And so in terms of the pre-positioning themselves, no. I mean, the stockpile does its own logistics from that perspective. In terms of, you mean like the caches that they have across the country? Is that what you're...
Well, no, I mean, we do pre-position stuff. I'm not worried about the distribution of what's in the stockpile,
Okay.
the non-medical countermeasures. If it takes 6 months to deliver
Right.
more of the matters you have. So I'm just curious. You don't have a surge capacity, apparently, so I'm just
Right.
curious.
The simple
as to whether
answer
or not,
is not exactly, and I think that's, since we keep dodging these bullets, has triggered all this conversations to have that ability to help that better.
One quick question to you, Jeff, if I might. There's been much discussion today about maybe bringing the Stafford Act and applying that in certain areas, and I was struck by that notion. And as governor, there were times that people wanted me to ask for a national disaster recommended, and there has to be a threshold. You just can't. There are a lot of bad things that happen around the state, but not everything rises to a threshold where you ought to get an emergency declaration. Have you and the folks at Columbia even thought about, if you're going to frame a declaration for a national public health emergency, what those parameters would be, what those thresholds would be before a governor or somebody could apply for a disaster declaration, and if we beefed up FEMA, getting the requisite response? Have you thought about framing that?
In the initial stages, yeah. I mean, this notion of a public health emergency response fund is relatively new in the current dialogue.
Not the fund.
But then,
okay.
Yeah.
Framing what the nature of the disaster before you can even apply for it.
Right. And that's where we sort of got into that, is what is the trigger to access the fund, and through the emergency declaration process. And I think part of it is that we need to go back and do some homework on what the current declaration process allows and doesn't allow. It's also hosted with the Secretary of HHS, whereas for the Stafford Act, it's hosted with the Office of the President. So where should that decision making occur? Should it occur at the presidential level or at the cabinet level in terms of making that, and the criteria in terms of expected cost? We have had conversations with local partners as well, too, where they've ramped up in anticipation of outbreaks overseas, like Ebola and like Zika and like others. And Ebola had far more ramp up than actual impact that was experienced. And yet there were a lot of costs that were unable to be reimbursed, that they're just constantly on the hook for. And so that's in some of those discussions where we're talking about sort of pre-disaster declarations. But it's sort of skirting around your question. And I think the short answer is that more work does need to be done to define that structure, because that's going to be critical to the success of any kind of emergency
Hannah would
response.
be very interested in any thoughts and specific recommendations you made in terms of framing. If there was to be a presidential public health emergency declaration, what it might be from your perspective. Secretary Shalala?
I have 3 quick questions for each one of them. First, for Dan. I know about CAT modeling. Does it include the capacity of the country to handle the disease? Because in the Nigeria case, we had infrastructure. And I'm wondering how far CAT modeling has gone.
It's a great question, and indeed it does. So the same way we understand the exposure to commercial and residential buildings for our hurricane model, we have to also understand exposure, in this case, human life, as well as the medical and other types of infrastructure in those host countries. So yes, it does explicitly consider those.
Great. Linda, the stockpiling of drugs is different than the stockpiling of needles and masks.
Correct.
So the emergency funds it sounded to me like you had masks on your shelves forever.
We did.
That means that they could just purchase and then figure out a distribution system.
Well, those were on our shelves in my members, so it wasn't in the stockpile itself.
On the government's shelves, they could actually warehouse that.
Right.
And have a different level of capacity that would handle some of the elasticity that you were talking about.
Some of it, yes. I think problem is when you think about the expiration, and then when you think about, are you building it all at once? Are you going to kind of stagger it? And if any sort of mass event needs so many numbers at once. I think we're trying to figure out what is that number, and then to kind of get to your point, do they stockpile it? Does what we have help? And what does that mean together?
Yeah, but some of the early discussions were to stockpile in the VA where it would be used, but you simply used a much more extensive purchasing process.
Right.
Or in major public hospitals, for example. But in a distribution system that would cover the country, simply order more and then keep it up to date.
Right.
Okay. And then, Jeff, you talked about public-private partnerships a little bit, but the major public-private partnership in public health is the tracking system for diseases and for the because individual doctors call their state to report a breakout of a foodborne disease or an infection, and that's the way we capture it.
Yes.
So we really do have an infrastructure for the private sector. We've invested in a tracking system that makes a difference.
To a certain extent, I agree. A lot of state and localities, it's done differently, and in some cases, it's still using the fax machine, and so the ability to aggregate and describe data and generate insights from that data, I think, is where we could use a lot more private sector ingenuity, particularly when it comes to business intelligence systems and the creation of operational dashboards. I think we're pretty good, as you mentioned, with the reporting process, but then actually being able to analyze trends and impacts and integrate into models and create insights into the response.
The other thing is, I didn't understand Ron Klain's, the problem that we had calling everybody who had been in West Africa, because during the AIDS epidemic, we called everybody that had AIDS and asked them who their partners were.
Yeah, and
which was a lot more people.
Yeah, and that's an important point, that on how much the workload exponentially increases as you get down to the state and the local level. And that's where, although we sort of look for national level investments, really bringing to scale the nuts and bolts of how to deal with a widespread epidemic, I think it's a fair point that we sort of have an inverted structure where we have a lot of national level resources, but we've seen local level resources really diminished over the years.
Right.
But that's where most of that work needs to occur.
And this committee has tried to balance
Yes.
the need for local resources and local investments with, the obvious federal role.
Absolutely.
Yeah. Thank you.
Chairman, I have no questions. I just thank the panel. Excellent. Just a few quick comments. One, when Tom and I were in Atlanta last week for this conference, I guess we knew about it before, but there was really strong feeling that the absence of an adequate, essentially advanced funding emergency fund at the national level meant that during a crisis like Ebola, when inevitably the government will want to have money to show the public that they're responding, money is cannibalized. And so local public health departments and emergency preparedness units lost out. So I just wanted to, I know you know that, Jeff, but I wanted to say that to build on your argument for emergency funding. Secondly, Ms. O'Neill, just to say really briefly, which I'm sure you know too, that one of the major reforms of FEMA post-Katrina was that it was pre-positioning and developing capacity to move what's necessary in a crisis, whether it's a hurricane or a tornado or whatever, to the area, which they were woefully. I mean, we did, Senator Collins and I did hearings on this, and it was amazing how much better prepared, for instance, Walmart and Home Depot were for Katrina than the U.S. government was. Dr. Knudski, in your modeling, do you do probability of pandemic disease outbreaks?
We do.
So we're all we all say and believe that it's inevitable that there will be another big infectious disease pandemic. Do you agree?
Absolutely.
Yeah.
Yeah, and actually we have, like I mentioned, hundreds of thousands of scenarios that are completely plausible,
Right.
that may or may not have happened yet. And if we're not considering those plausible scenarios that we haven't seen in our lifetime, then we're putting ourselves at risk.
Yeah. And is it more likely than the obviously wildly unforeseen Spanish flu outbreak in 1918?
It's certainly plausible that there could be pandemics on a scale greater than what we have seen in our lifetimes.
In part because of what we all know, we're traveling more movement, yeah.
Absolutely. The virulence of the diseases or the travel patterns, all of those variables are considered in our model, and there are definitely some worst case scenarios that we could create for you.
Okay, thank you. Thanks, Mr. Chairman.
Questions from our colleagues on the ex officio panel. Dr. Ways.
Thank you. On the private-public partnership, the emphasis on education and the role of education to raise the awareness. In a way, the light at the end of the tunnel in the past 3 years is a growing interest on the part of governments, for example, State Department, as well as international organizations, NATO, OECD, WHO, and others, to work together with educational institutions, universities, think tanks. So for the past 3 years, some of us are developing a curriculum that can be used for undergraduate, graduate, security institutes, and so on and so forth, in order to raise the awareness and knowledge. So I really think this has to be encouraged and bring in different segments of the society, including not only public health institutes such as yours at Columbia, but also schools of journalism, for example, how to report about the situation in order to avoid the panic, for example, in the public.
Yeah, and we agree with that completely at our center. We're forming actually a partnership with the School of Journalism and their Center on Disaster Response because we recognize how important attention to these issues and shining a light on them actually makes it relevant in the political circles, and also the connections with business measures and being able to answer business questions when we're primarily equipped to answer scientific questions is also an incredibly important hurdle to overcome in order to continue to get traction on these issues. So I completely agree with what you said, and great to hear that so much is going on with that.
So Dan, I happen to believe, like you, that large-scale simulation modeling can contribute much, but we also heard, and there are skeptics, as you well know, so CDC was offering us 1 million people infected with Ebola. Had you run at the same time simulations that ended up with an endpoint which was much similar to what the outcome was?
I will say that we have, again, all of our scenarios are developed ahead of time. So we have those hundreds of thousands of scenarios. And I will say that we have, in technical terms, similar stochastic events that show that it could have been much worse than what we experienced. And importantly, insurers consider all of these scenarios as non-zero probabilities of occurring. If they said it was zero and it occurred, they'd go bankrupt. So the insurance industry considers those scenarios as non-zero probabilities, and so too should the government.
Absolutely, but on the probabilistic scale that you're working with, so my question was, did you have proactive models that ended up much closer to less than 20,000 deaths versus a million?
Right. I can't speak exactly what we had during that outbreak, but I'm happy to run that model and show you the output.
Anything else, please?
There you go. Thank you. So these are really about the insurance questions. And so one, I didn't hear, we know a lot of these outbreaks, pandemics, the cost or the losses are mostly non-medical. So in these projections, 80, 90%, tenfold is the economic impact for business, other things. So are you including those is my kind of first question. So we've just seen recently with Zika, 80% of the cost of Zika have nothing to do with medical care, but travel, tourism. I'm sure that you're covering that. The second question, and maybe you can help with this, is, and you always recognize the pioneers because they have the arrows in their back. So forgive me for shooting at your back on this for being a pioneer. But the work with the World Bank on this pandemic insurance, my understanding, and we work a lot with the bank, is that the cost of those policies will be borne by other parties, donor countries, like the United States will put in money to cover the policy cost for poor countries. And there's no pricing, like my insurance, I price on risk. They don't have to do anything to mitigate risk in order to get their insurance coverage. So I'm a little concerned about the bank's plan, which is an incentive not to do anything. And also it doesn't pay out until they reach a threshold like $100 million. So a government leader in a small country in some part of the world can let things run out because at 50 million they get nothing, but if they let it go until it's 100 million, then they win 100 million from the fund. So that we have some concerns about how that's developing. I wonder if you might have access to influence the bank. We're certainly trying to, but as they say, well, we have to start somewhere. But we're hoping they go further than starting somewhere.
Both excellent questions. The first is that our primary clients for our pandemic model are the insurance industry. So they care about insured losses. So primarily that's life and health. Right, so that is the primary. Our primary clients want that output. That said, we can model and do model other elements that you're talking about. What comes to mind first would be business interruption. So business interruption insurance will reflect a lot of those costs that you talked about. But it's clear that there are economic costs even beyond that that could be modeled, but we don't have any clients from the insurance industry that are asking us to actively model that because it's not an insured loss. On the PEF with the World Bank specifically, first I have to caveat this by saying I'm not an employee of the World Bank. I'm a vendor to the World Bank, and I also have an active contract with them, so I can't get into specific details about what we're doing with them. But I will say that remember that this is focused on the poorest countries in the world that may not have the ability to fund any efforts on their own. And the World Bank, I believe, thinks that by providing this immediate funding, the other member nations can come together and stop that outbreak from becoming a pandemic through the use of funding immediate needs. It may not be perfect, but it's something. And I will say that our firm in particular has been very engaged in helping the World Bank determine triggers, like when should an outbreak qualify for funding. And in my view, as an emergency manager, this is a really innovative program because it's not often in my field that you can see a disaster happening in front of your eyes and a trigger can have an immediate impact and lessen the consequences in such a dramatic way. So I think there's real potential there, and I think it's very innovative, but I understand certainly your concerns about the need for clarity of some of these items, including mitigation and triggers. And I can say that those are active discussions right now, and not in all cases have been final decisions been made.
I'm going to forewarn you, as we did the previous panel. Once you've testified, we keep the record open for at least a year. Don't be surprised to hear from us. And I'm going to encourage you folks, we're running a little bit late, but the individual we asked to speak next is worthy of another 15 or 20 minutes of your time. And once the panel leaves us, we're going to have Max Brooks share some thoughts with you. Many may be familiar with his critically acclaimed novel, World War Z, which is a fascinating look into our world. But more importantly, is a non-resident fellow of the Modern War Institute at West Point. Senior Resident Fellow, Art of Future Warfare Project at the Brent Scowcroft Center on International Security at the Atlantic Council. So I'm going to ask this author and scholar, Max Brooks, please join us.
Thank you. I will be brief. I have sat there for a good 12 to 13 hours, and I've listened to a lot of experts, and all of them geniuses. What I haven't heard is a way to communicate and engage the public. And I think that this would be wonderful in isolation if we lived in a country with a permanent ruling class that could take care of the big issues and let the rest of us peasants go on and live our lives. But we don't. We live in a republic. We live in a democratic society where public engagement, public support, public cooperation is paramount. And I haven't heard anything about that. Is how do you deal with the mass psychology of boomeranging between denial and panic? Because that's how society works. You're either in complete denial, where you think, well, this doesn't affect me, or you're in complete panic, where you think, oh my God, I need to put a bucket on my head and shoot at anybody who comes near my door. And I've lived through all of that. And I can tell you that we are now in full denial mode. And we are in full denial mode for many reasons. Some of it are short-term, some of them are long-term. Part of it is long-term because, let's be honest, we've made a conscious effort in this country since the 1960s to avoid hyperactivity on the part of the citizenry. We don't want this country tearing itself apart like we did in the 60s. So we've had this sort of divorce of overactivism. Part of it was the end of the Cold War, where we literally thought, well, I think there was some moron who called it the end of history. And whoever that person was, find who they are and punch them in the face. Because it was not the end of history. Things were going to still happen to us. But there was this attitude in the country that the Cold War is over, we can all go home, happy days are here again. Part of it was, let's be honest, Iraq, where right after 9/11, we were involved. The American public jumped right back into the fray and were told, and this is direct quote, to pray, hug our kids, and participate in the economy. And that's it. That was all we were asked of. But we gave the government our full support because we were told that there was a country that had weapons of mass destruction that was coming here. And they didn't. And we cried wolf. And the public took it as such, that if Saddam Hussein doesn't have weapons of mass destruction, therefore nobody does. And so we've gone from the hyper-panic of 9/11 to complete denial, where people don't want to be engaged at all. We have also successfully, in my lifetime, gone to war against science, gone to war against the news, gone to war against truth, to the point now that people are all living in their own bubbles and believing what they want to believe. And we are now reaping that whirlwind. And if we are going to protect ourselves, we need to get back to that. We need to get back to realizing that we all live in one country and that we are the people. We are the government. The American people, we govern ourselves. And so while we talk about logistics, we talk about science, we talk about the law, we talk about involvement in various government agencies, we also need to talk about how are we going to communicate these ideas to the American people. When I was a kid growing up in the firestorm of AIDS, what saved us was a guy dressed like him, a guy who looked like an Amish admiral. And he had a calm demeanor and a funny beard, and he went on TV constantly, and he woke us up and calmed us down. And make no mistake, that's how we beat AIDS in this country, with education. Still don't have a cure. But public education, engaging the American people, explaining AIDS is deadly serious, but it's preventable, and here's how. And that's how we did it. And so when there is another outbreak, and as we all know, it will happen, public education, public involvement is going to be as vital as any of the physical assets that we have at our command. So how are we going to do that? How are we going to get in the middle road between complete denial and outright panic? How are we going to bridge this partisan gap? Because let's be honest, this government of the people, are acting like divorced parents, dividing up issues like they're furniture. You get that issue, I'll get that issue. But no, as we've said, germs affect all of us. Germs don't have voting records and party lines. So how is everybody going to come back? How are we going to confront the partisans on both sides of the aisle that are trying to tear us apart? And that is on both sides. Conservatives, when I hear this, I hear the conservative rhetoric of, well, this is big government bureaucracy, I don't want to have to pay for this. I also hear the liberal rhetoric of, well, I read on the internet somewhere that vaccinating my kids will give them 3 heads, and so therefore I'm not going to do it. In my hometown of Santa Monica, California, was ground zero of the measles outbreak. These are educated people. These are people who thought they were so elite, and yet they weren't vaccinating their children. Well, where is the guy dressed like him to tell us, no, you need to do this? You know who did it? Jimmy Kimmel, a talk show host, actually had doctors on his show who, pardon my language, literally direct quote came on and said, vaccinate your goddamn kid. And that woke people up. Because that has to happen. Because, in a way, we're also victims of our own success. None of us now have to worry that if our child has a headache or a fever tonight, that they're going to wake up with polio. We can all sit down and have salad, raw vegetables from a restaurant, knowing that it's not going to kill us. 100 years ago, we fought tooth and nail to combat the viruses that used to murder and maim millions of Americans. And we've done it so well, we're 3 generations out, that things like the word polio is something that your grandparents talk about. So how do we remind them? How do we remind the American people, no, these viruses aren't extinct. They're not dinosaurs. They can come back, and they can affect us all. And all of us need to respond. That's all I'm going to say.
Does anyone dare seek to offer a question?
Chairman, I would like to follow up on one thing that Max
Go at
said.
your own peril. Go ahead, Senator.
No,
Then again,
first of all,
the
let me
subject
just
that was-
compliment you on an eloquent and passionate statement, and you can see from the reaction how much in agreement we are. But I think the big challenge we face in this era of fake news and allegations of fake news is discerning fact from fiction. And whether it's measles and vaccinations or climate change or any one of an array of things, our people, the people of this country and the world today, are faced with an enormous challenge of discerning truth from fiction and fact from the unrealities of rhetoric. You obviously have thought about this a great deal. How are we going to get out of this mess, this dilemma that we're facing today as we have a president of the United States, in some cases, who makes assertions that I would challenge? I think most people do. So how do we deal with that?
I think, honestly, that elected officials need to have the courage to confront partisans that might have been useful to their political careers at some point. There does have to be what I call the John McCain moment. When Senator McCain was running for president and that woman talked about Senator Obama and said he's an Arab. And you could see where McCain's soul came forward and said, no, he's not. And that courage was matched by General Powell, who then went public and said, what if he was? So what? Is there something wrong with a Muslim kid in this country thinking one day I can be president? Now, these are Republicans taking on elements of the Republican base who might have been very helpful to them, at the risk of their own reputations and their own careers. And that kind of courage as Americans is what we need. That's what we all need. You know, I would say this happened in, I believe it was the 1960s when the Republican Party took on the John Birch Society and said, no, we're not part of you. We're here for all Americans, and we need to do that. When Jenny McCarthy talks about not vaccinating your kids, it is the role of liberals and Democrats to confront her and say, no. You are not a scientist. You take your clothes off for a living. Good for you. But that does not qualify you to tell me not to give my child a vaccination.
Thank you, Max.
Well, I think that we should buy you a uniform. Ask you to grow a beard. And there's an important role for you in America's future.
Thank you.
Surgeon General Brooks. Oh, we'll waive that. You've been great. You're really. I mean, the Paul Revere metaphor is overdone, but you've played that role today, and we.
Well, I can't think of a more fitting and appropriate conclusion to this first of several meetings we're going to have this year. We all in this panel, the ex officio members, we've had a pretty regular attendance and sustained commitment from a lot of people in this theater today. To your point, as we discussed with you and others, how we elevate the notion this is a real threat, it is a real risk. Let's not ignore that reality. Let's also not ignore the reality. With the right approach, with the right public policy, we can manage it just like we manage everything else. So let's accept that reality. And I also remind you, there was a great lesson last 2 years ago, the Allegheny College in my old congressional district, they give a civility award every year. 2 years ago, they gave it to John McCain for that moment. You know who his counterpart was on the other side? Vice President Joe Biden. When a nominee for president said the Republicans are our enemies, he said, no, they're not your enemies. They're your opponents. So we got a lot of work to do, elevate it, and wish we could elevate it to the tone and the focus that you just did for all of us. Thank you very, very much.
Thank you.